With more than 1 million surgeries and at least 21 million patient services now delayed, something exacerbated by the COVID-19 pandemic, the Ontario Medical Association has some ideas for a long-term solution, alongside calls for immediate funding to manage the current demand. To tell us more about this, we welcome to CP24 Tonight Dr. Adam Kassam, President of the OMA. Thanks so much for making time tonight.
Thank you, Chanel.
Doctor, this plan includes 87 recommendations, including how to reduce wait times and address the surgical backlog here in Ontario. So let's start there. How can we do that?
So first of all, Chanel, this is an important week for healthcare in Ontario. We're on the cusp of a budget announcement on Thursday and an election that will ramp up in earnest in a couple of weeks. And what Ontarians are looking for during this campaign is a roadmap for the future of healthcare in this province. And as you're describing, Ontario's Doctor's 5-point plan for better healthcare has a roadmap to do just that. It's our prescription for Ontario. And when we think about, for example, the 21 million healthcare services that you're describing that have gone delayed, someone's hip or knee replacement, someone's cataract surgery, a colonoscopy, a mammogram. What we describe as a roadmap for the future includes something called an integrated ambulatory center model that will help to offload certain hospital procedures and surgeries into a new model of care that can actually then be more efficient, more cost-effective, as well as more timely for the patients.
What does that model of care look like?
Well, so it is actually a partnership in and around the hospital established infrastructure that exists right now. It would be OHIP-funded, publicly insured services that would happen in these centers that could actually do, for example, specific types of same-day hip or knee surgeries. It would be able to do cataract surgeries and other ophthalmologic procedures. It would also be able to do things like ENT procedures and certain types of endoscopy. So being able to offload hospitals so that they can focus on acute and emergent care is really a model that has been replicated around the world, including parts of Western Europe, in the United States, and even in parts of Central Canada to good effect.
So do we have the infrastructure to deal with something like that, or does this need to be built?
So this needs to be built over time, and it's also why we believe that this needs to be a shared commitment by all levels of government. We know that, for example, over the past 30 years here in Ontario, we've suffered from chronic underinvestment in healthcare by all political parties. And so what we need is immediately coming out of this pandemic, and we know that we're still in it, that we're encouraging people to mask and distance where appropriate. We're encouraging people to get their vaccine, their first, second, third, or fourth doses as eligible. But we really want, for example, the federal government to increase Canada Health transfers to 35% of provincial and territorial spending in order to be able to build capacity that we need right now and into the future.
Okay, another priority that was really heightened during the pandemic, Doctor, was mental health and addictions. How can the government better address those issues?
Well, certainly at both a federal and a provincial level, Chanel, we see that there is commitments to, for example, the establishment of ministries and specific types of funding that goes with it. That is welcome news. We know that mental health and addiction services are most acutely affected in places that are rural, remote, or northern that don't have access to a psychiatrist or a mental health provider. We need to be able to not only shore up what we have in these environments, but then also have commitments to not only increase domestic supply, but also an international health human resource strategy to encourage those types of healthcare workers to come and serve the population.
The OMA also, Doctor, concerned about the return of, quote, missing patients. Can you explain a bit more about what that means and how this really impacts the healthcare system at large?
Absolutely, Chanel. Over the past 2 years, there have been a number of patients who have either delayed care or were too worried to come in to see a doctor or go into the hospital for obvious reasons as it pertains to COVID. They didn't want to get sick when they went into the emergency room or into the doctor's clinic. But what happens as a result of that delayed care is that small problems become bigger problems. And those bigger problems are now what we're seeing in our clinics in the hospitals. And these bigger problems are not only harder to treat, they have worse outcomes for patients, and they're also more costly for the system. And so put together, this delayed care has started to become problematic in the healthcare space, and what we're encouraging patients to do is to come back and ensure that they get the care that they need at the time that they need it.
Okay, as we look ahead, Doctor, to life after COVID, how prepared are we, is Ontario, to really handle another potential public health crisis in the future?
Well, I hope that we've learned from this ordeal over the past 2 years. What we know to be the case is that we need to adequately fund public health units to the tune of making sure that their governance models are unified and that we have a consistent approach and an ability to react. We know that that was stressed and challenged during the past 2 years. That's why in our prescription for Ontario, we've been calling on both the federal and provincial governments to continue their support of public health units and the important work that they do on a day-to-day basis.
So you mentioned this, Doctor. We're around the corner from an election. The NDP today releasing their platform. There was a big focus on healthcare. Just wondering what your thoughts are on that and what you'll be looking for coming up on this Thursday during the budget.
Chanel, we know that healthcare is going to be top of mind for folks. We can't have an economic recovery without a healthcare recovery. And as the head of the OMA, we're focused on ensuring that healthcare is on the ballot, that public health is on the ballot, that the future of healthcare in this province and for future generations is on the ballot. And we're encouraged by all political parties putting this on the map in their election platforms. We obviously take a nonpartisan view of the election, but we're encouraged by the initial signs from all political parties that they have commitments to improving healthcare, and we want them to know that the Ontario Medical Association stands as a partner for our patients.
Dr. Kassam, on a personal note, this was your final briefing as OMA president. I know the pandemic obviously has been a big chapter in this term, but what will you remember most, and what's next for you?
Gosh, thanks for the question, Chanel. It's shocking to even figure out that I'm at the end of my term, but really I've been so buoyed by the support from all different healthcare stakeholders, from physicians across the province, and I couldn't be more proud of the healthcare professionals who day in and day out have sacrificed life and limb to be able to serve the people of Ontario, and being in a position of leadership to represent those voices has been a humbled privileged position, and I couldn't be more proud of my colleagues.
Well, best of luck to you on your new adventure. Dr. Adam Kassam, thanks so much.
Thank you, Chanel.